Have you ever wondered why some investments in primary care lead to major improvements in health? Yes, we see in clinics full, coverage expanding, and quality actually improving, while in other settings they do fail to deliver. Equipment goes unused, medicines are out of stock, and patients literally travel further, often paying way too much out of their own pockets to seek care elsewhere.
One answer gaining increasing attention around the world is performance management, the continuous process of setting goals, tracking progress, and actively using that information to improve services over time. This approach is built on three interconnected pillars: strong systems and tools such as clear targets, reliable data, regular feedback, and effective supervision; managerial hard skills, including data analysis and interpretation, problem solving, and action planning; and managerial soft skills such as leadership, communication, and the ability to motivate teams. When these elements come together, something powerful happens. Primary healthcare systems begin to improve continuously, even in settings where services are small, dispersed, and difficult to manage. That is why performance management is increasingly seen as a force multiplier for primary care. But in many countries, these elements are not yet in place. Health leaders often face common challenges: weak data systems, unclear priorities, and limited managerial capacity to translate information into action.
To help navigate these challenges, the Joint Learning Network on Universal Health Coverage brought together 35 national and sub-national primary care practitioners from 13 countries for a 2-year learning journey. Through peer-to-peer learning, sharing of practical experience, and joint priority setting and activity identification, the Collaborative for Primary Healthcare Performance Management aimed not only to produce practical knowledge products, but to test them in real-world conditions. The journey began by grounding the work in both global evidence and country experience. The team conducted a review of the literature alongside in-depth discussion with country delegates to understand the real-world challenges they face in their daily work. This included selecting the right indicators, improving feedback to providers, and integrating fragmented performance management systems across different vertical programs. From this, the group identified a set of priority topics. This became the basis for a series of virtual learning sessions during the first year of the collaborative, combining global expertise with country experiences. This step was critical. It ensured that participants share a common understanding and language, enabling more meaningful exchange and collaboration.
But this was much more than a traditional knowledge-sharing initiative. The majority of the collaborative-supported activities during the second year was dedicated to implementation learning. This meant supporting countries not just to learn, but to design and test real changes in their systems based on the learnings. 3 of the countries focused on strengthening the hard skills of primary healthcare managers and supervisors. Together, they co-developed a diagnostic tool to assess skill gaps, designed a practical training curriculum, and created adaptable materials for different country contexts. They also developed terms of reference to support the recruitment of trainers. These training programs were piloted in selected districts, with countries tracking results using a shared set of indicators. You can hear more about each country's story in a separate video on the JLN website. But the pilots recorded significant increases in knowledge and confidence in areas such as IT skills, data analysis, data visualization, quality improvement, and leadership.
The second implementer group focused on improving the dashboard that were used for primary care, from their decision makers right down to their clinics, as a critical tool to support their performance management system. Pilot countries in this group were supported through a similarly step-by-step process that started with tools that were created to understand the needs of different kinds of dashboard users. Then look at how to select the right measures to display, how best to visualize them, and how to roll out the new dashboard in a way that meant it would actually get used.
Across the collaborative, results were pleasantly strong. Participants reported significant gains in knowledge as well as confidence. The share of participants who considered themselves extremely knowledgeable in PHC performance management increased from a mere 3% at the start of the collaborative to nearly 60% by the end. Beyond learning outcomes, there were also tangible impacts on service delivery. For example, in Liberia, one clinic reduced patients' waiting times by around 40% through a quality improvement project developed as a part of a practical module on quality improvement in the training program.
Building on these experiences, the collaborative transformed what was learned into a set of practical global tools. In hard skills training, the following tools and materials are now available for countries to use and adapt, including a skill assessment tool for primary healthcare managers, the training curricula, including interactive activities, PowerPoint presentations, and facilitator guides from the pilot countries covering the key hard skills topic, a sample terms of reference for trainers, and monitoring and evaluation tools, including the pre and the post assessments.
On the dashboard side, all tools have been consolidated into a single comprehensive toolkit. This guides users through a preparation phase, including stakeholder engagement tools and a dashboard maturity assessment, a design phase with guidance on selecting indicators and creating effective visualizations, and a rollout phase with practical steps to ensure dashboards are used consistently to support decision making.
Lastly, we encourage you to explore these tools on the Joint Learning Network website at jointlearningnetwork.org. There you will also find videos guiding you through both the hard skills and dashboard redesign toolkits in more detail, with stories from the implementer countries that use them and are now scaling these programs up. We also invite you to join the conversation, share your own experiences, provide feedback, and let us also know how you are using these tools in your own context. You can find details to contact the Assessor Global Facilitation Team on the PHC Performance Management Collaborative.